House Bill 2310. Imagine this. A Texas family is trying to find early learning support for their young child with disabilities. They call one agency for therapy, another for pre-K, and a third for childcare help, only to learn that none of them share information or coordinate services. Months pass while their child waits for consistent care. What the bill says it does. House Bill 2310 tells three state agencies, the Texas Education Agency, the Health and Human Services Commission, and the Texas Workforce Commission, to work together on a 4-year plan to improve early learning and inclusion for children with disabilities. What it actually does? It makes these agencies responsible for identifying barriers, setting goals, and recommending policy changes. This means state agencies can now shape the statewide plan for disability inclusion, while local schools, childcare providers, and parents only get a voice if they're invited into the process. Now, who benefits? Families who've struggled with disconnected systems, advocacy groups that get a formal role in shaping the plan, and state agencies that gain authority to coordinate early education policies. Who pays the price? Local school districts and small child care centers that may face new expectations without new funding. Families in rural areas if recommendations are made but never funded or implemented. Why this matters. When agencies don't work together, kids fall through cracks, and parents carry the burden. House Bill 2310 could make early education more inclusive, but without money or accountability, the plan could become another government report that never reaches the classroom. Questions I'll ask your lawmakers. How will the state ensure these plans lead to real improvements instead of sitting on a website? Will there be public input or legislative review before these recommendations become policy? And can families and educators track how well the state follows through on the plan? Bottom line, House Bill 2310 is a well-meaning step towards inclusion, but it will only matter if the planning turns into action that families can see and feel.